The AGM noted the alarming rate of brain drain in the Nigerian healthcare sector, with numerous competent medical professionals emigrating to developed countries due to poor working conditions and inadequate remuneration. The AGM observed deteriorating infrastructure and equipment in many healthcare facilities, significantly hampering effective healthcare delivery and training of resident doctors. Subsequently, the annual general meeting resolved as follows. Number 1, the AGM calls on the Federal Ministry of Health and Social Welfare to develop and implement clear, healthy call-duty working hours for doctors in line with international best practice. In the interim, the AGM directs that effective 1st October 2025, members of NAD should desist from engaging in more than 24-hour calls, 24 hours of continuous call duty. Effective, I hope the press is getting us clearly, effective from 1st October, we are directing our members to no longer take calls beyond a duration of 24 hours. Excess workload is a real problem, burnout is a real problem. And it is time something is done about it to protect the lives of doctors who in recent months and years have been losing their lives in the course of serving their nation. The AGM calls on the Federal Ministry of Health and Social Welfare to clearly state and implement the relativity in professional allowances between the Commerce and Conhealth salary structure to ensure equity and proper compensation. The AGM demands that the federal government urgently pay all accumulated promotion arrears owed to our members across all federal institutions within 30 days. The AGM calls on the federal government, through the Federal Ministry of Health and Social Welfare, to grant chief executives of hospitals less encumbered means of employing doctors and replacing those who have left the system to reduce excessive workload on existing members. This can be done through the implementation of the one-for-one replacement policy proposal. The AGM gives the Federal Ministry of Health and Social Welfare and the management of Federal Teaching Hospital Lokoja 30 days to reinstate the 5 sacked medical doctors there. The AGM demands the prompt settlement of all arrears arising from the 25-35% upward review of Commerce, the 2024 accoutrement allowance arrears, and outstanding salary arrears within 30 days. The AGM urges the Medical and Dental Council of Nigeria to immediately restore full recognition of the West African postgraduate membership certificates to their previous status and calls on the National Postgraduate Medical College of Nigeria to commence immediate issuance of membership certificates to deserving candidates in line with global best practices. The AGM calls for a decentralized and streamlined process for the upgrading and promotion of doctors to enhance both training efficiency and clinical service delivery in full compliance with the Medical Residency Training Act. The AGM demands the immediate commencement of specialist allowance payments to all doctors, given their central role in delivering specialist medical care across healthcare institutions nationwide. The press may wish to note that the ongoing CBA that has been stalled would have ordinarily finalized on this particular allowance. And we hope you will bring this forward, bring it to bear, so that federal government will know that NAD means business. The AGM calls on the Federal Ministry of Health and Social Welfare to to facilitate seamless and sustained employment of doctors to address the alarming rate of brain drain and ensure adequate healthcare delivery. Again, a few years ago, the one-for-one replacement policy, I think it's a policy, it wasn't circularized, would have addressed this. There were concerns raised, solutions were proffered, and I think the federal government walked away from the table on the side of non-implementation. I think it is time the one-for-one replacement policy is brought back to the table. We cannot continue to work ourselves to death. We cannot continue to have doctors who choose to leave this country, and there are those who are here ready to serve, not having access to employment, rather being casualized, rather being given locum employment that they have to review in 2-3 months or 6 months' time, thereby giving chief executives the right, the opportunity to victimize our members. One-for-one replacement ensures that one person leaves and the next available person comes in immediately. Whatever bureaucratic process is involved, it is not NAD's responsibility to solve it for government. When other issues are involved, government finds a way to solve it. I think government can also find a way to solve this one. The AGM urgently calls for the immediate inclusion of medical and dental house officers in the civil service scheme, ensuring prompt payment of all their rightful emoluments and timely issuance of payslips. The press may wish to note that these are the only set of skilled labor that works for the federal government that has no payslip at the end of the month when they receive their salary. When you look inwards into what they take home, you see a whole lot of irregularities. I think there is still time for the federal government and the MDCN to sit down and solve this problem before the situation degenerates even further. The AGM demands that His Excellency, Governor Seyi Makinde of Oyo State, urgently addresses the welfare concerns of resident doctors under state government employment, especially at Lautech Teaching Hospital, Ogbomosho. The AGM urges all state governors to prioritize the welfare of doctors and other healthcare workers in their various state-owned hospitals and training institutions as a strategic means of curbing emigration and maintaining industrial harmony. The AGM endorses the promotion of medical entrepreneurship among resident doctors as a complementary strategy for income diversification and healthcare system strengthening. The AGM resolves to strengthen advocacy efforts with the National Assembly to ensure adequate budgetary allocations for healthcare and medical training in the 2026 Appropriations Act. At the end of the annual general meeting, elections were held. During the AGM, transparent and credible elections conducted resulted in the following distinguished leaders being inaugurated to serve as the National Officers Committee for the 2025-2026 executive year. The immediate past Secretary General, may you please stand up for recognition, Dr. Odumbaku Kazim Oluwashola. The immediate past President, Dr. Oshindara Tope Zenit. You are recognized, sir. The Deputy Editor, Dr. Agbanuchi Mezema Kingsley. You are recognized, sir. The Editor, Dr. Ademo Adebi Babafemi. You are recognized, sir. The Publicity and Social Secretary, Dr. Abdulmajid Yahya Ibrahim. The Financial Secretary, Dr. Isa Solomon Baba. You are recognized. The Treasurer, Dr. Kabiru Sali Sulawal. The Assistant Secretary General, Dr. Ahmad Bamanga Umar. The Secretary General, Dr. Shaibu Ibrahim. You are recognized, sir. The Second Vice President, Dr. Kevin Kwarshag Yakubu. You are recognized, sir. And then the first ever female first Vice President of the Nigerian Association of Resident Doctors, Dr. Divine. My humble self, your dogged servant, the President, Dr. Muhammad Usman Suleiman. As is our tradition in NAD, succession is always in our plan. So there was a bidding process on the center to host the next annual general meeting in 2026 for the 2026-2027 Expo year. And the Association of Resident Doctors, University of Calabar Teaching Hospital, ARD-UCTH, in Cross River State, emerged victorious with a record-breaking 84 votes in the competitive bidding process, and was awarded the privilege to host the 2026 NAD annual general meeting and serve as the secretariat of the 2026-2027 NAD secretariat. With Dr. Oga Emmanuel Idoko emerging as the Crown Prince of NAD. Please stand for recognition. Crown Prince, sir.